Well, good afternoon, everyone, and thank you for joining us for a brand new Healthline 3, where we love to focus on ways that you can live a healthier, happier, pain-free life. And today, maybe even help you see better. It's all about the eyes today. And we're going to be opening things up to answer your calls, a show dedicated to you, our viewers. So before we open up the phone lines, which we'll be doing here in about 5 minutes, make sure you find yourself somewhere quiet so we can hear your question and you can hear us when we give you the answer that you are looking for. So with that being said, brand new Healthline 3 kicking off, and I want to introduce today's featured guest, Dr. Norman Zaffater from Willis Knighton Eye Institute. Dr. Zaffater, thank you. Great to see you, sir.
Thank you for having me.
Yeah, pleasure to see you. This is your first Healthline 3.
Yep.
So yeah, for those that may not know, of course, tell us about your experience at Willis Knighton Eye Institute and what we'll be diving into today.
We're going to talk about some of the new advances in cataract procedures and the lens implants that are available now and how they can correct your prescription. So not only can we improve your vision by removing cataracts, we can also correct your prescription. So a lot of times we can, patients can get more freedom from glasses for not only for distance vision for driving, but also for reading. And so it's very exciting things we can do for patients, and we really get a lot of gratification from it. Patients are really happy, and that's kind of the bottom line, is be able to give them the freedom to keep doing things easily. And so it's very gratifying, and it's an honor, actually, and a privilege to be able to do this for people.
Yeah, I bet it is.
Absolutely.
When you look at something as serious as cataracts, it affects a lot of people, millions of Americans.
Absolutely.
Yeah, and so right now we'll be opening up the phone lines in about 2 or 3 minutes. So if you are dealing with cataract issues, maybe a loved one is, a family member, make sure you give us a call. We'll be opening that up. Dr. Zaffater, if you would, tell us a little bit about yourself, how long you've been practicing.
So I've been practicing for almost 30 years.
Nice.
I went into practice in 1997, so next year will be 30 years.
Shreveport guy.
I grew up here and went to Loyola High School, and then went to LSU Baton Rouge, and then stayed in New Orleans for medical school, and then came back to Shreveport for residency training.
Yeah. That's awesome.
Yeah.
Why the eyes? I'm always fascinated to see why doctors kind of choose what they do and to get into that, for lack of a better term, specific body part.
That's a good question. Yeah, when I was in medical school, you get to a point in school where you have to sort of decide which way you want to go.
Yeah, right.
And I was at a point where I had to do that, and so it was interesting. My father, actually, one of his really good friends, his son was doing this in Dallas. And he said how much he enjoyed it and how much he felt privileged and honored to be able to do this for people. And so I started looking at it, and I originally started getting interested in it when I was in anatomy in the first year of medical school, and the anatomy of the eye.
Yeah.
And it kind of sparked some interest there, and then I kind of pursued it further when I got further into medical school, and really became very interested in it and did research there, and it just kind of grew from there.
Yeah.
So it's been a really good decision, I think.
I bet. I'm
Absolutely.
sure it has, and you've treated a lot of people here, and that has to make you feel good.
Absolutely.
Yeah.
I mean, it's like I said before, it's a really gratifying procedure, the procedures we get to do, and because there's such an immediate improvement. Some things with healthcare, they're not so quick to improve.
Right.
But this is one of those things where patients literally go in for the procedure struggling with their vision, and then the next day they can see a big improvement in color, clarity, nighttime vision, and so it's a pretty dramatic and sometimes emotional in the positive way for patients, where they feel like they can have freedom, to be able to do things for themselves. They don't have to rely on their family to do things, for drive at night. And things like that. So it's really a pretty amazing thing to be able to do for people.
I'm going to go out on a limb here and say that I bet a lot of your patients use this phrase, I should have did this a lot sooner.
Absolutely.
Yeah.
So all we can do is, when patients come in, is we examine them, we check their vision, we tell them what's going on, and then ultimately we tell them, it's your decision as to whether to go forward with this. If you feel like you're struggling enough with daily activities to go forward with it. It's an extremely safe procedure. It's painless. Patients are given sedation during the procedure, and so they actually take a nap during this. It takes 5 or 10 minutes. And they wake up and their surprise is already over.
Wow, that's interesting.
And so it's very, very patient friendly.
And who would be your typical patient?
Right.
Is it always someone that's a senior citizen, or break that down for us?
No, really, cataracts can happen at any time. Typically, though, it's age related. In other words, you get into your 60s, 70s, just the normal processes of the body create some cloudiness of the lens, which causes light scatter and decreased vision, particularly at night, but it can affect daytime vision too, reading, those kind of things. And so actually it can happen any time in life, and there are children that can develop cataracts. They can actually develop at birth, and so sometimes it's not very common, but if it does, then they can have the procedure as well. And then there's other conditions like, for instance, diabetes. Cataracts can develop at a younger age, 20s, 30s, 40s. But the typical is later in life, 60s, 70s, 80s.
Sure. Well, with that being said, let's right now open the phone lines, 318-219-4569. If you have a question for Dr. Zaffater, maybe you may be dealing with some cataract issues right now and you're looking for some treatment options, give us a call and we'll answer those questions for you. And let's talk about that. What basically these lens implants, kind of what exactly, how does that work?
Okay. So ever since the 1970s, I think like early to mid 70s, that's when lens implants were developed. Prior to that, the cataract was literally removed and there was nothing put in its place. The cataract, even though it's a cloudy lens, it still focuses light. So if you remove it, there's nothing there to focus the light. So you end up with Coke bottle glasses, really thick glasses.
Yeah, right.
And that's what the standard of care was up until the 70s. But then lens implants were developed, and they're biocompatible, so the body doesn't react to them. But what they do is they focus the light, and so it essentially replaces the natural lens with a clear lens. So the basics of the procedure are you're replacing the cloudy cataract lens with a clear implant lens, and those lenses have been improved upon since the 70s. And so nowadays, we can correct prescriptions, astigmatism, distance vision, and up close vision. So those have improved and keep improving every year.
Yeah, that's fascinating.
And it's pretty amazing that patients can not only get better vision, quality, but then they can get out of glasses.
Right.
So they can they can wake up in the morning and not have to immediately reach for glasses.
Wow.
Or have to clean them when they get dirty, or they're outside a lot. If you do outdoor things, which a lot of people do, this gives a lot of freedom.
Yeah. Does that help with like distances as well too? Depth perception, things like that?
Absolutely.
Wow.
So when we do this, typically patients say, wow, the colors are so much better. Red is really red, blue is really blue. Because the cataract, the cloudy lens, filters out color. And so patients, and it's very gradual. And so patients, they get this done and they're like, wow, I had no idea.
Yeah.
It doesn't happen overnight.
Right.
And so a lot of times patients are very, very pleasantly surprised at the quality of color, sharpness of focusing, night vision, all those things get improved upon. So it's really, really a nice thing.
One thing you touched on is how quickly people recover from something like this.
Absolutely.
Are we talking, I mean, your eyes seem something very serious. Are we talking months or weeks here?
No, absolutely not. It's one of the things that's improved over the last several decades is the procedure. The instruments that we use are super tiny, and so that's gotten smaller and smaller. And so what that does is allows us to make super tiny incisions, and so everything heals really, really fast. And so people can get back to their normal activity right away. The only thing you have to be careful about is heavy lifting. That's really the only big thing that we tell patients not to do. And we typically
strain your eyes there. Yeah.
We typically we do one eye at a time, and so usually it's a week for each eye for heavy lifting. After that, so the next day you can drive, you can go to work. As long as you don't do the heavy lifting, then you're fine.
Yeah.
So a lot of patients are relieved to hear that because their work, they're active, they like to do things, and so they're not bedridden for really any time. So the day of the procedure, they get sedation, and so that stays in your system for a day, 24 hours. So we just ask them not to drive, but they can do other activities as long as it doesn't involve anything like heavy equipment or driving.
Yeah, right.
After that, the next day they can drive, they can go to work, they come in to see us for a quick check.
The very next day.
The next day.
Full use of their eyes like that.
Absolutely.
Wow.
And most of them are really excited about doing the other eye because they see the improvement in the first one, and they can truly see the effect of the cataract by comparing the vision of both eyes.
Wow.
So like, when can we do the other one?
Wow, that's fascinating.
So we tell them we'll do it in a week. We'll get them, settled down for the first one, and then they're equally clear out of both eyes.
That is fascinating.
Absolutely.
I got to ask you a silly question because I have it in my head. You're talking about now you're a man, you don't have small hands. How do you operate as a doctor? How are you using these ultra fine
That's a good question.
tools?
So it's just like anything. You get trained to do this. It takes a long time.
Oh, I bet.
And so, when you start, a lot of times you feel like, can I really do this? But you gain confidence and through training.
Sure.
You go to medical school for 4 years, and then you could do an internship and residency for 4 years. So you get plenty of practice. I trained at LSU Oxnard Shreveport here, where there is, thousands and thousands of patients that come in for eye care, and so you get plenty of experience with taking care of patients in the office for different things, glaucoma, diabetes, but you also get a ton of surgical experience, which really is invaluable. When you start off by observing plenty of surgery, and then you slowly increase your hands-on procedures, and then you build confidence. And after doing with residency and with practice, what is that, 33 years, 34
Yeah.
years? So there's really not much I haven't seen or done, and so at this point, you feel, you gain confidence, and that you really feel like you can handle pretty much anything.
Yeah, I like that. And you want someone.
Absolutely.
Yeah, you want someone to have that experience and that knowledge too. But I find it fascinating because you have to always be upping your game with
It
the
never
technology.
ends. You learn every day. I learn new things.
That's awesome.
There's always something new coming out.
It sure is. And we got a new caller on the line right now for Healthline 3. Let's open it up right now. 318-219-4569 is the number to call. And I believe we have Birchie on the line. Good afternoon. What's your question for Dr. Zaffater?
Hello.
I had both of my eyes done last year for cataracts. Now, I don't use my glasses anymore for driving because I can see distance pretty good.
Correct.
But I still have a trouble with close-up. But the thing I also have is I'm still having foggy eyes sometimes, and I'm worried about that. It hasn't burned off. They said, well, it'll probably go away.
Okay.
Is there something I can do about that?
Absolutely. The first thing to do is get an examination. And the doctor oftentimes can do certain things to optimize your vision. It could be dry eye. It could be that the lens implant has haze on it from normal healing, which we actually use a painless laser to clean the lens. So there's a lot of things that can be done to sort of optimize your vision, there can be other things going on that can be improved upon, which can ultimately lead to better vision. So that's the first thing I would do.
Okay, right now, I went to the doctor. He did recommend some for the dry eyes, and I'm still using that. Now, the other thing is I can't see very good. It looks like the distance close up is
I can explain that.
It was before.
So that has to do with the type of lens implant that you received when you had your procedure done. Did you have what we do at our office is when we identify a cataract and we see that it's causing visual problems, we sit down with the patient and we go through what their options are. depends on what they're a candidate for. Sometimes if they have other problems like glaucoma or diabetic problems with the eye, then we will kind of personalize their recommendations. So when you had your procedure done, you most likely chose a lens or were offered a lens that corrected your distance vision. And with the understanding that that would improve your vision quality, but you would still require reading glasses to see small print up close. So nowadays we have a lens that gives you both. And that's another thing you might not have, that might have not been available when you had your procedure done. So, and so those two things are most likely what happened. So I would talk to your doctor about it and determine if there are ways to improve your near vision. Sometimes we can actually do LASIK or laser to bring one eye up close. So you can read with that eye. It sounds strange, but it works. You can read with one eye, and the other eye you can continue to see to drive and watch television. It's called monovision. And we do that quite often on patients that don't want to have to wear any glasses at all. So there's so much technology out there. I would investigate that if your goal is to get out of reading glasses.
Yes.
Hopefully that answers your question.
That sounds like the superhero option.
Yeah,
The superhero
supervision,
option there.
right?
Yes, I like that. Well, Bertie, thank you so much
Yeah,
for the call.
thank you so much for the good question.
Yeah, great call there. 318-219-4569. See, I love that because that is what the show is dedicated for. You are viewers. So if you're watching right now, you're dealing with some eye problems, maybe grandma's dealing with some eye problems, give us a call right now. We about halfway through, believe it or not. So now is the time to pick up the phone. Let's go right back to the phone lines right now. We have Jimmy. Jimmy, good afternoon. What's your question for Dr. Zaffater?
Hello.
Yes. I'm in the process of having work done on my eyes. And I had a severe glaucoma and cataracts.
Okay.
The problem is on my right eye.
Okay.
And I'm having some like itching on both eyes.
Okay.
And I'm scheduled to go in. Matter of fact, Monday.
Okay.
For something else doctor wants to do, and it's at LSU optional. Dr. Lee Hain.
Okay.
Are you familiar with her?
Yes, I know Dr. Lane. Yeah, absolutely. She's a glaucoma specialist over there. Yeah, you're in good hands.
Oh, she is?
Yes, sir.
Okay, that's one of the things that I'm concerned about, you know.
Yeah, she'll take really good care of you.
Sir?
So
and listen to you, you know, I'm like, man, I may need to go and check him out.
Well,
you
could certainly come to our office, and we're in Bossier, Willis, Knighton, Bossier, in the medical pavilion over there. We'd be happy to see you if you'd like to do that.
Jimmy, thanks for your call, buddy. We do appreciate it. Sorry you're dealing with these eye issues, but thanks for giving us a buzz, and good luck there. Check him out, though. Dr. Zaffater, you're taking patients right now, right?
Absolutely.
Talk to us, for those that are watching right now that may get a chance to call. Hopefully you do. The phone lines are open right now, 318-219-4569. But for those kind of like Jimmy that may need some options here for finding it, how do they go about getting in to see you at Willis Knighton Eye Institute?
So our phone number is 318-212-7373. They can call and schedule an appointment with us. We're located, there's Willis Knighton Bossier, which is it's across I-220 from Airline High School. And then there's several buildings. There's the hospital, and then there's the wellness center, and then there's the pavilion where we actually do cataract procedures. On the first floor, there's day procedures, like cataracts and other orthopedic procedures are done there. And our office is actually on the fourth floor of that building, so everything's all in that one building. So yeah, absolutely. If someone wants to come see us there, we'll take really good care of you. We appreciate patients that entrust us with their eyes.
Yeah.
We don't take anybody for granted.
Yeah.
When they come in, they're VIPs, and we have an awesome staff. Yeah, I can't do this alone.
Yeah. And it really
And
does
so-
take a team, right? Any successful person
It really
that
does.
sits on this set and tells
we-
us about has a team behind
And
them.
we've been so picky about our staff because when patients come to the doctor, I've been to the doctor, I've been to the eye doctor, and you get nervous.
Sure.
I mean, it's your eyes, you know.
Yeah.
And so we realize that, and so the people that we have at our office are phenomenal. They make people feel comfortable. They answer questions, and they treat patients like family, and they try to make them comfortable
Yeah.
because it really helps. And a lot of patients have told us that because it's very important to treat patients like that so they feel at ease, especially with this, because when they're going to have like a procedure done, anything you can do, answer all questions, that lowers their anxiety. And so having been a patient, that's helped me enormously in taking care of people in that regard. It's been really a good experience that way.
Absolutely. I like that a lot.
Yeah.
For the folks out there watching right now, Dr. Zaffater, that maybe it's been 3 or 4 years since they've been to the eye doctor. Maybe it's been longer than that. And they're having some issues. You know, Jimmy was just talking about his eyes being scratchy or itchy there.
Absolutely.
When is the chance that they should, or when is the time that they should be reaching out, whether it be their primary care physician or start
Right.
getting in to see you?
Yeah, I think any time they're having vision problems or irritation, it sounds like he's got allergies, to be honest with you. And there's tons of things we can do for that to get them more comfortable.
Something simple like that. Hey,
Absolutely.
okay, that's easy.
Absolutely.
Yeah.
A lot of things that are really simple and straightforward. So you can check with your primary care doctor first. A lot of times they have enough at their disposal that they can get you much better. And if they don't feel comfortable or if the patient's not getting better, they'll call us and we'll get you in right away and take a look. What we do at our office is we have standard appointments for patients that need to come in, but we also have some openings for patients that are having more acute problems. So we can get you in right away so that you can start feeling better, or your vision will improve, those kind of things. We have that set in our schedule because we know things happen. Patients get injured, different things like that, or they develop problems that they really need to get better.
Well, let me paint you a hypothetical, because I'm sure in my head we have this scenario out there. Somebody's watching at home. Maybe let's just say you're a little older, your husband's a little older. It's not easy for them to leave their
Right.
home. And they're kind of concerned, well, I need to get in to see
Sure.
Doc, but my husband can't drive and I can't drive.
Right.
How are you able to help that specific set of people? Because we got some watching right now that are like that.
So it's a transportation issue kind of thing?
Yes.
That sort of thing?
Yeah.
Well, I think there's some services available out there. Of course, Uber or Lyft.
Okay, but it is something
But-
like you encourage folks that even though like they may,
I see what you're saying.
they got to get in there to get the doctor. You got to stay up on something like your eyes too.
Absolutely.
That's kind of what I'm getting at here, the importance of that.
Yeah, I mean, I think there are some things that we can certainly recommend things over the phone if they're not able to come in. We over the phone we can kind of triage it, or we can sort of screen out things that we really need to come in. We really. And there are some rare situations where I'll go to their location. I mean, I've done that in the past.
Wow.
Yeah. It's not very common, but
Sure.
if,
We don't
if
wanna
it
get into
sounds
that.
like if the situation comes up where there's no way they can come in, and it sounds like a really serious problem, then we can figure out something like that.
And you guys are there. That's the big point that
Absolutely.
we want to stress today. They do have the team there. Well, 318-219-4569. We got a couple of minutes left, about 2 more minutes before we're going to have to close up those phone lines. So give us a call right now and let us know. Now, we've heard about the use of eye drops a lot.
Absolutely.
How effective are those when it comes to treating cataracts, or is that just something that's kind of just a temporary fix?
Yeah, I mean, cataracts are definitely you have to have a procedure for that. There's no drops or medications you can take to get rid of cataracts.
Yeah.
So maybe in the future that
not
may
now.
become available, but not right now. There's
Right.
nothing available that has been tested and researched that would do that. So there are other things though that can be treated with drops. I mean, glaucoma is optic nerve damage from eye pressure being too high, which causes loss of peripheral vision. And we can treat that with drops. There are other alternatives if patients have a hard time putting drops in. We have a laser we can do to lower the pressure, and that's pretty popular because most patients don't like to put drops in every day forever.
Right.
And so we give them options, which I think is nice. That's a very popular thing to do, the laser, because patient, they have to keep up with the drops. And then a lot of times squeezing the drops are not easy. You hit your cheek
right.
instead of your eye.
Yeah.
So we tell them all that and say, hey, you know, if you don't want to do all those things and go to the pharmacy every month or every several months to get them refilled, then here's an option for you. So we try to give patients options like that, and I think they appreciate it. So.
Yeah. I know this is a little broad, but it's right up your field. How often should people see the eye doctor?
Okay, that's a very good question. So I think, you know, kids, it's a good idea to, actually in schools they do screenings, vision screenings. And then they'll refer to the pediatric ophthalmologist if necessary. I think it's a good idea to get a baseline exam as a kid, maybe before 5 years old or 5 to 10 years old, just to make sure everything's good, because a lot of times kids can fool you. They can pretend like they're seeing good, they're not. And then going forward, I would say maybe one or two times in your teenage years, and then in the maybe 3 or 4 times in your 20s, and then as you get older, maybe more frequently. As you get into your 40s and 50s, maybe once a year, just to check for anything that you may not have symptoms of. Glaucoma, there are no symptoms. And so you can be losing vision peripherally.
Wow.
And no pain or any changes, and we discover it in the office.
Oh boy.
And we can treat it and prevent it from progressing in like this, which once it progresses in like this, you can't get it back.
Yeah.
And so those are the kind of things that can be screened for in the office, and they become more common as you get older, unfortunately. So, but it can be identified and treated, so it won't, as you go into the future, it won't cause a problem.
Yeah, boy, oh boy. That's hard to believe. There's a multitude of things that we can live with as people, and we have no idea. That's a little scary. But
it is a little scary, but you can come see the eye doctor. All eye doctors, optometrists as well as ophthalmologists, can screen for glaucoma. So it's just wise to get a baseline exam just to make sure, you know, that everything's good.
Yeah, I need to do that. So I really do. I say that every time. Now, can we expect a little puffs of air? Is that still the thing?
So that's one way to check pressure. There's other ways that aren't quite so like scary or catch you off guard.
Sure. Yeah.
So, but there's ways like that. If patients don't want that, then there's alternative ways to check the pressure.
Okay.
So
the point is, we got to get in there. We got to get things checked, because we may be dealing with some issues that we don't even know about too. But cataract's a big issue too, Doc, and we just want to stress too that if folks are out there and you are dealing with some cataract issues, if you didn't get a chance to call today and you have some questions, how can folks reach out to you or your team? You're easy to find.
Absolutely. They can call 318-212-7373. That's our office number. Also, we have a website. It's www.z, the letter Z as in zebra, eye center.
Okay.
And they can ask questions on the website as well. Probably, those two ways are the primary ways you can ask questions. If you have about your eyes, if you're having some problem, that's the best way to do it.
Yeah. So. And get it checked now. Don't wait, because just, as we started things off, we know there's going to be people out there that get it done. They're going to say, "Oh, I should have did this so much sooner."
Yeah.
Well, Dr. Zaffater, thank you so much for being here today. This is really enlightening.
My pleasure. Thanks for having me.
Yes, and this was his first. Did a great job, and hopefully not your last, sir. Hopefully
Absolutely.
We'll see you back
Anytime
very
y'all need me, I'll come.
Fantastic. Well, we're going to bank that. Well, check him out, Willis Knighton Eye Institute. Dr. Zaffater, him and his team doing big things. Check him out now if you're having some eye issues, especially with cataracts. Thanks again, sir.
Absolutely.
That was our Healthline 3. Remember, for all the details, you can always find this Healthline 3 and more by going to our website at ktbs.com, KTBS Plus, and keep watching every month for much more news to keep you healthy and happy and keep you seeing clear. That's going to do it for us. We hope that you have a happy and healthy day.